This video discusses red blood cell antigens A, B, O, and Rh factor. I will then give some blood typing examples and help you practice. At the end, I will present a possible pathological issue between a mother and fetus during pregnancy. When we're talking about blood typing, what we're referring to are these oligosaccharides that are expressed on the surface of the red blood cells. These oligosaccharides are important in cell signaling and help the body recognize what is foreign and what is itself. So when we're talking about the A, B, and O antigens, as you can see, they're all fairly similar, and there really is only one variation between the O, A, and B. The O type is essentially the template, and then the A and B have either the N-acetylgalactosamine or the N-acetylglucosamine attached to it. So when we say that someone is an AB positive blood type, that means they have the A antigen, the B antigen, and they'll have the O antigen as well expressed on their surface. The positive and negative refers to something else, and that something else is called the Rh factor. There are many different Rh factors. We estimate that there's around 50 or so, but the one that is important in our case in blood typing is Rh positive and Rh negative. Rh positive means that you have the antigen D. Rh negative means that it is absent on the red blood cell. So going back to our original example of an AB positive individual, that means they have the A antigen, the B antigen, and the Rh antigen. If they were O negative, that means they only have the O antigen and they do not have the Rh antigen expressed on the surface of their membrane. So let's get into some blood typing problems. Say we have a patient that is A positive. So think about that for a minute. What does that mean? That means this patient has an A antigen and they have the Rh antigen. What about antibodies? What antibodies does this patient have? So if this patient had an A antibody or an Rh antibody, it would attack its own red blood cells and this patient could potentially die. So we don't have any A antibodies or Rh antibodies, but we do have B antibodies. So I'm going to draw a B antibody very simply. Some of you are probably going to make fun of me for it. So there's a B antibody. So if this patient were to be administered some blood from a donor that was A, B positive, then that would mean this antibody that our recipient has will come and attack the antigen of the donor, and it will cause the donor's blood to coagulate in what we call a transfusion reaction. And our recipient could potentially die from such reaction. So it's very important that we're careful with the blood typing that we do. So I'm going to give you two examples to think through, and I'll walk you through them as well. The first one that I want to go through is a patient that is, let's say, AB positive. So what does that mean? That means we have an A antigen, a B antigen, and an Rh antigen. So what antibodies does this person have? Well, he has none because he has these three antigens. That means we could potentially give this recipient any blood type. So if we put an A positive person in there, there aren't any antibodies in the recipient's blood that will attack the donor's blood. So we really don't have an issue there, and we won't get a transfusion reaction. You could also have a B, or it could be an O type person, and they could also be negative. it really wouldn't matter. What we call this AB positive individual is a universal recipient. So let's do one more example to think through. The next example I want to do is an O negative individual. So think in your head, what does that mean? O negative. O means that there isn't an A antigen or a B antigen, and the negative refers to a lack of an Rh factor. So there aren't any antigens on the surface of this red blood cell. But because of that, we do have several antibodies that this person makes. This person has the A antibody, the B antibody, and the Rh antibody, which I'm just going to show as a plus. So what type of blood can this person receive? Well, if we put someone that has type A blood in there, this antibody will attack it. Same if it was the patient had a B antigen or an Rh antigen. Essentially, this person cannot receive blood from anybody else except for another O negative. Next, I want to talk about the pathological issues that you can find in a mother and her baby during pregnancy. So first we got to talk a little bit about what this placental barrier is. I'm sure many of you have heard of the blood-brain barrier and how it blocks a lot of different things from being able to cross into the brain. Well, the placental barrier is very similar, and it disallows a lot of different antigens and antibodies to cross this placental barrier. All antibodies cannot cross this placental barrier except for the IgG antibody. And it just so happens that our RH, so our RH antibodies are small enough that they can cross this barrier and come into the fetal blood and potentially cause a miscarriage within this baby. So it's a very serious condition. So in order for something like this to happen, the mother would need to be an R negative individual. It doesn't matter whether she's A or B, because those antibodies can't cross the membrane anyway. So the mother, if she is R negative and the baby is R positive, we can have some complications. The reason for that is the mother can produce antibodies that can cross this barrier and attack the Rh antigen that the baby has within its blood. When we first discussed the Rh factor, I think we were a little bit misleading when we talk about the blood typing, because the first pregnancy that this mother has, she does not produce the Rh antibody, and her baby will most likely be okay and nothing's going to happen to it. But when the mother has an injury or when the baby is born, there's going to be some mixing of blood between the baby and the mother, and the mother is going to be exposed to these positive antigens, and her body is going to start to create these antibodies. So if the baby's born and she hasn't made these antibodies, it's generally okay during that first pregnancy. If the second baby is Rh positive as well, then the antibodies that she had created from the first pregnancy will carry over and could potentially cause a miscarriage, and those antibodies will attack the fetus's red blood cells. So it's a very serious condition, and there is a drug that we use that can help treat erythroblastosis fetalis. And that drug is called Rhogam. Rhogam is a synthetic Rh antibody that can't cross the placental barrier. In the event of an injury in the first pregnancy causing mixing of blood, these antibodies can hide the baby's Rh antigens from the mother's immune system. This will prevent the mounting of an attack on the foreign antigen in the mother's body. The mechanism by which Rhogam does this isn't completely understood, but it is hypothesized that the presence of the synthetic antibody tricks the mother's immune system into thinking it has already mounted a defense. So it's a pretty cool drug. Anyway, I hope that helps you when you're preparing for this next exam. Generally, they like to have a couple of questions on this blood typing and on this pregnancy thing in particular. So I hope you found this helpful, and good luck.